Lung cancer can be divided into three broad different categories. The first is localized lung cancer, where patients have a small tumor and no lymph nodes in the center of the chest. The second is locally advanced lung cancer, where patients have lymph nodes in the center of the chest. And the third is advanced or metastatic cancer, where the cancer has escaped the lungs.
Advanced lung cancer comprises usually stage 3 or 4 disease, or what medical oncologists would consider to be advanced stage lung cancer, a tumor that has spread to the regional lymph nodes in the chest or to some distant site in the body.
So the locally advanced lung cancers, or stage 3, are two different ones. First is 3A, where patients have lymph nodes on the same side of the chest as the tumor, and 3B, where patients have disease on the other side of the chest, but not in the other lung. Those two cancers are treated differently. They're both treated with the intent of curing the cancer, but in different ways. Patients with stage 3A can have surgery, and patients with stage 3B can have chemotherapy and radiation in an attempt, again, to cure the cancer. But the majority of those patients will not be cured.
Stage 4 lung cancer is considered metastatic, where the tumor has spread to a distant region where surgery would not be an option in any curative intent purpose. And the mainstay of treatment for stage 4 disease would be some type of systemic therapy.
The first is chemotherapy, the second is immunotherapy, and the third is targeted therapy, and those are for different patients. We can also sometimes use radiation therapy in patients with stage 4 disease to try to alleviate symptoms. For example, when patients have disease in the bone, which is causing significant pain, radiation can help significantly.
When something's not considered curable, usually offer them some type of treatment for their disease, but that treatment is not going to result in eradication of the disease. The treatment that is being given has the goal of prolonging their survival, meaning allowing the patient to live longer than they would than if they did not have any therapy at all. It also has the goal of palliation of their symptoms. They may be having symptoms related to their disease, and by palliating those symptoms, easing those symptoms, that can improve their quality of life.
So in the past 15 years, two very big things have happened in lung cancer. The first is the advent of targeted therapies. Targeted therapies are oral therapies that treat very specific types of lung cancer. Approximately 15 or 20% of patients with lung cancer have this special type of lung cancer, which is generally found in never smokers, although it can happen in smokers. These patients are treated with these drugs that go to a specific site in the cancer to turn that cancer cell off, and they're extremely effective. They're actually more effective than chemotherapy, and they cause significantly less side effects than chemotherapy. The second big finding in lung cancer has been immunotherapy. Immunotherapies are newer therapies that aren't toxic like chemotherapy or don't attack the cancer directly like chemotherapy or targeted therapies. They activate the body's immune system so that those immune cells can then attack the cancer cells and kill them. And these obviously are very important things because these drugs have been proven to be better than chemotherapy in certain specific scenarios and are now approved in almost every scenario in lung cancer. Many patients don't have a lot of information about lung cancer. Some of them haven't heard about the newer therapies that can prolong life and can improve quality of life and have had a significant impact in the treatment of lung cancer.